I don't know.
Okay, we'll
Technology
just go
is
with
not happy today. There must be just too much water coming out of the sink.
it. I'll take that answer. Yeah. So thank you so much, everyone, for coming today. So strong from the start. I really felt that this was a great title for talking about empowering dads as they work their way through the perinatal journey, and as we focus on mental health and how healthy dads can really be a healthy part of creating a healthy family. So there's a lot of importance behind having healthy dads as it relates to the perinatal period. Okay, let's see. Oh, I might have to have you do it, Anne.
Okay, that's fine. There's
Sorry.
no
Okay,
controlling.
next one. So an interesting and pretty powerful statement was that fatherhood begins before birth, and supporting dads in their perinatal journey isn't just about their well-being. It's about strengthening families, fostering connection, and ensuring every parent feels seen, valued, and prepared for the road ahead. And just recognizing this, I think, is a piece that gets overlooked a lot, that fatherhood actually happens before birth, during pregnancy, preparing for pregnancy, all of that. We oftentimes leave dads out. So we need to reframe how we're looking at fatherhood, and remembering to include those dads in the time before birth. Go ahead, next slide. So today we're going to be talking about a few different things, actually quite a few different things. And there will be spots where we can take a pause and ask questions if you have them, or talk about specific details in a little bit more depth. And Anne's going to be watching the chat, and that will be when we have a quote or a main slide. So we will be talking about what is perinatal mental health and why we should be focusing on dads, what we know about paternal mental health, some risk factors to look at from both a clinical place and as a partner or family member, how to identify the symptoms and support fathers, as well as screening and identification. And then at the end, some takeaways and some resources that both professionals and individuals can use in their own resource bank. Next slide, please. So, Anne, you did a great job introducing me. So my name is Teresa Eltrich. I am a perinatal mental health therapist. I have been specializing in the perinatal mental health world since about 2006. As it kind of began to get traction and awareness was increasing, I was lucky to have started at that time. So it's been a really wonderful journey to see the changes that have happened in the perinatal space. And it also has been a great place to be, to see where we need to go. And I think that this is a wonderful opportunity. I really appreciate being able to come and speak today about how we need to be including fathers in this care, and how they need to be an active part of the perinatal period, and how we need to be caring for them. One of the reasons, oh, I'm just going to say one little thing. You don't have to go back, Anne.
Okay,
One
sorry.
of the reasons why I focus on, that's okay, why I focus on perinatal mental health and why it's been so close to my heart is that this is an area where there is recovery. There is a light at the end of the tunnel. And so as a therapist and mental health provider, it really is powerful to be able to support people who are feeling helpless, or that a moment that should be joyous is a time of crisis or struggle, and being able to really walk with them through that, and encourage them to get to the other side. So I just want to remind everyone that although some of the things that we're going to be talking today are big and sometimes can feel overwhelming, there is recovery and there is healing. So that is why I do this work, because I appreciate that. So we'll talk a little bit about what perinatal mental health is. Perinatal mental health refers to the emotional and psychological well-being during pregnancy and the first year postpartum. Now, when we say this, I like to remind people, so with the work that I do a lot of pregnancy preparation and working with families who have had losses and who have had infertility or fertility struggles. So, what I want to remind everyone in this group is that the perinatal period, although we talk about during pregnancy and the first year postpartum, we also need to be recognizing that the process of becoming pregnant also needs to be addressed, and parents need to be checked in on during that time, pregnant or not. Going through the process is a very powerful time. And dads, a lot of times too, are left out of those conversations. And the perinatal mental health field oftentimes is talking about perinatal mental health as it relates to mothers. And so this conversation that we're going to have today is going to talk about the commonalities that perinatal mental health has across paternal and maternal areas, but then some of the specific differences for paternal mental health that we need to be aware of. When people refer to perinatal mental health, a lot of time is kind of like an overarching umbrella. And so what it is kind of covering is anxiety or anxiety related disorders. So you might see OCD, which is obsessive compulsive disorder, PTSD, post traumatic stress disorder, and some of the other anxiety family diagnoses, as well as depression and adjustment disorder. So, an adjustment disorder, for those of you who maybe have heard that term but don't understand or don't know what that is, it's any transition in life that creates some kind of emotional or psychological response. So, in this case, having a baby is a huge life transition, and for a lot of families, there is a adjustment that is happening, and so the diagnosis of adjustment disorder describes that emotional reaction to a life change. Next slide. So it's important as we talk about perinatal mental health to really look at who can be impacted. For so long, we've really only focused on the moms, and that, a mom just had a baby and we need to really think about how she's doing. But as we do more research and we understand how this transition impacts families, we really need to focus on other support and caregivers that are involved in this family. It can affect, like we were talking about, mothers. It can affect fathers. It can also affect caregivers. So that might be grandparents that are caregiving for the infant while the parents are not able to. It might be grandparents or relatives that are living in the home where the baby has come back to. It can also include foster parents, which we don't a lot of times look at, and it can include adoptive parents as well. So, and with adoptive parents, that also includes the birth family as well as the adoptive family. So, not only the parents who gave the baby up for adoption, but also the family that has brought the baby into their home. Next slide, please. So, just to kind of expand a little bit more on the paternal mental health and maternal mental health. Paternal mental health impacts at least 1 in 10 fathers, and we'll talk a little bit more about this in just a few slides. It often has unique symptoms and a later onset, which are really important to know and to understand, especially for providers. More research needs to be done, and luckily there is research that is happening right now around paternal mental health and how to support screening and resources for those fathers. Just to be able to understand different risk factors and treatments and screening adjustments that we need to make to be able to do that appropriately. Maternal mental health impacts about 1 in 5 mothers, and that may present in pregnancy and anytime during the postpartum period, so the year after birth. Onset times may vary, but it typically appears in the first 6 weeks and continues on. So a lot of times we hear about baby blues, and there's oftentimes confusion about, is this baby blues or is this postpartum depression? But the baby blues usually is shorter in duration and more transient, lasting around 3 weeks. After that, we need to start looking at what symptoms are occurring and what symptoms are staying around. Next slide, please. So perinatal mental health is just not just for moms. So paternal mental health, or it's called paternal depression. A lot of times it's referred to that. Just like with maternal depression, we need to remember that there are a lot of other things that can come along with that. So we might have anxiety and depression, and we need to recognize that it's not just depression, but a lot of times it's just kind of a general term that people use. Um, and again, it is often discussed in relation to mothers, but fathers also experience significant emotional and mental shifts during this period. And with fathers being left out oftentimes of the perinatal mental health conversation, it often is due to being perceived as the caregiver, and that might be physically. So mom comes home with the baby, dad, and this is kind of like one of those societal stigmas that dad needs to take care of the family and make sure that things are going how they need to go. Emotionally needs to be the rock, financially needs to support. So there are a lot of reasons why stigma has left fathers out of those perinatal conversations. Next slide, please. So perinatal mental health matters for fathers because fathers play a crucial role in the family dynamic and child development. Like Anne was talking about initially when we started talking today, the and I'm using this as like a generalization, but the roles of the two parents in the home often are um, do different things. What we know about the role for fathers in interactions with their children and infants can oftentimes be more of encouraging exploration. It can be more playful. It can be more physical. So there are a lot of different ways that a father can enrich and encourage growth for their children. Um, if you have a father that has poor paternal mental health, it can definitely impact those attachments and bonding because the interactions look different. It also has a huge impact on the relationship with the partner. So if you are having discord within the family system and the partners are not communicating or interacting well, that also can impact developmentally for that infant. And just overall family well-being. How are they interacting in social systems and social interactions? How are they interacting with outside families, or even down to engaging in supports like doctor's appointments and well child visits, things like that. So there's a lot of reasons why we really need to make sure that dads are getting the support that they need and that they're healthy, because they play such an integral role in the child's development. So, how common are perinatal struggles for fathers? So, what we do know is that about 1 in 10 fathers experience postpartum depression. And, like I was saying, when we say postpartum depression, a lot of times it's like a general term, but we really need to look at anxiety and depression as two separate things. And nearly 20% of new fathers struggle with anxiety related disorders. So we need to be talking about depression and anxiety when we're talking to dads, because it can look um, similar but also different. And we'll talk about that a little bit more. But I think that this number is really important to focus on. Even though the statistics show that it's about twice as common in women than men, um, we still need to do a lot more research to understand how are we screening, where are some of the biases and stigmas that are impacting those results, and how can we adjust that to make sure that we're getting the accurate numbers to know really what are we needing to do to care for those dads and their mental health.
So Teresa, before we jump forward, I just want to reflect on one of the comments around one of our dads saying, I'd say that 100% of fathers experience pregnancy anxiety. And so, yes, absolutely. And lots of thumbs up
Oh,
around that. But what I just want to be just reminding people that when Teresa's talking about this, she's talking about this from like a clinical definition, which is different. Yeah, got it. Okay. He says, yeah, I got it.
yeah.
But
Thank you for,
absolutely,
yeah,
yes.
yeah.
And that's part of the
So,
story, right, Greg? Because
right.
a lot of times dads don't have a place to express that prenatally. They don't have
Right.
somebody to talk to. No one is focused on them. How do you feel about becoming a dad? How is it,
I'm
what
scared
are
to
you worried
death.
about? Yeah, all of that.
I'm
So
just
anyway,
being, I'm just be adding a little levity. I know.
I know, I
I
know, I
knew
know.
you were talking clinically.
I just wanted to call that out.
Well, and that raises a good point. Thank you, Greg. And I, as a therapist and a clinician, I'm coming at this, like I said, from a clinical standpoint, educational piece. But I also want to recognize that I am a woman and talking about paternal depression. And so I do respect that. And I do understand that if there are comments and experiences, I welcome those. So please share that. I really appreciate that. This is just the education that I have and the work that I've done with new families and dads too. So like I said, I appreciate anyone who has any feedback or any stories to share. So thank you, Greg, for saying that. It is very anxiety producing. And I always feel, especially for families that are going through like fertility treatments or who've had losses previously, it's unfortunate that dads can't be validated more frequently that this is scary. I think a lot of times, like I mentioned, emotionally they are perceived to be kind of like the rock, and they need to be the one that's there for the mom if they're anxious about the pregnancy moving forward. So having an outlet is definitely helpful. Sorry. so so we'll get back to what we know. So what we do know about paternal depression is that there are similarities. So if anyone Googles postpartum depression or perinatal mental health, you'll come up with a created list of things to look for. Um, what we know is that, yes, that can carry over to fathers, but what we also know is that there are a lot of differences in how fathers respond and how men respond to anxiety and depression that are oftentimes overlooked and can be misdiagnosed. And so being able to talk about those differences, and as a provider, from a provider standpoint, being able to educate other providers that although it may look like something else, what are we really needing to address? Is it really depression or anxiety as we're moving through this perinatal period? Because what we know with maternal mental health is that um, during this period, it is a very specialized, it's a very particular, special moment in time. And a lot of times there might be symptoms that come up that are different than pre-pregnancy or even years after a birth. So we just need to remember that mom, dad, family member, this is a special time that symptoms can look different, but we also need to remember that just because they look different doesn't mean we need to classify them as a bigger diagnosis than the perinatal period. If that makes sense. So there are unique symptoms for the paternal mental health and presentation. It may present during pregnancy of a partner, and like Greg was mentioning, there might be anxiety or worry during a pregnancy, or even depression. But what we typically are finding is that fathers are reporting the most symptoms between 3 and 6 months, usually peaking at about 6 months postpartum. And more research really needs to be done about why this is happening. But from a clinical standpoint, knowing that around 6 months there are a lot of really big changes that are happening. So a lot of times maternity leave, paternity leave is over. People are kind of going back to their normal routine. People aren't dropping by anymore to drop off meals or check in on how you're doing. And financially, now we have extra finances. We might have daycare that we have to pay for. We might have diapers, or if we're not breastfeeding, there's expenses for formula. And if you have a baby that is particularly fussy, or maybe has an allergy to an ingredient in the like that the mom's eating, or that the formula has, there might be an extra cost to specialized resources. So we know that at 6 months there are a lot of things happening, and so more research really needs to be done, and especially actually thinking about how many people are actually impacted by depression and anxiety. One thing that I want to note also is with paternity leave, we need to do more exploration and research around paternity leave, and how mental health is attached to that. Currently in the United States, research indicates that most people support fathers receiving a share of paid paternity leave, but dads are only taking a portion of that. And so I think there needs to be more exploration on why is that. Are there reasons, social reasons that dads are going back? Are there reasons why, is there, what is the pressure to return to work and not to meet that need when we have available resources for that? So I think there needs to be a little bit more conversation on that, but definitely a lot more research needs to happen. And it's good that we are doing research finally and addressing it, but I think more needs to happen. So we'll have more answers. I mean, even if we did this webinar in a year, we probably will have more research and more information.
And Teresa, what we hear from dads and folks who are interacting with people around bonding leave, paternity leave, is that there are multiple dynamics there around the employer's receptivity and support, around a reduced wage and the inability for families to survive on that amount of money. And so there's a lot of complicating factors around how fathers are supported to be dads in the workplace. So yeah, we're really interested in hearing that research. And Gabe, I'm going to hold your comment until we take a break here in a bit.
We're almost there. So what we do know also regarding risk factors is that there is an intersection between risk factors for maternal mental health conditions and paternal mental health conditions. But I tried to focus mostly on some of the things that are specific to fathers. So life balance and an increase in responsibility. So like I mentioned, there might be changes to work pressure, pressure to provide. There might be different family dynamics that are coming up. And then like mentioned before, lifestyle changes, financial changes, having to provide for daycare, having to provide for diapers. There's a lot of things that come up that we have to take care of, and I think a lot of times that comes up as a stress for dads. Lack of connection, so relationship communication, communication stress with partners, reduced sex life. Those things can really play a role in risk factors for fathers feeling connected and actually part of the family. Hormone changes also can be a significant risk factor. So with the reduction of sleep, which anyone who has had a crying baby at 2:30 in the morning, knowing you have to get up at 5:30, that's really, really tough. And hormone shifts are definitely related to sleep. So there can be a decrease in testosterone, which can lead to an increase in depression symptoms as well. So those are important things to remember, that it's not just moms that have um, hormone shifts during the perinatal period. Perinatal birth complications is one that I think also gets overlooked quite frequently. Um, like we were talking about with pregnancy, oftentimes anxiety during pregnancy, or leading up to the birth or during the birth. If a family has had a traumatic birth experience, there might be significant fear around the death of a partner or baby, especially if there is a second pregnancy after that may be complicated or potentially be at risk. There might be detachment and distancing if a dad doesn't know how to communicate that that is scary for them. There also might be other kinds of reactions to that fear. Perinatal loss is also a significant risk factor. Having a miscarriage or stillbirth, those can be risk factors because it also, if we're having symptoms of um, if we're having symptoms of depression or anxiety after the birth of a loss. So if you have a second birth, there might be a disconnect and feelings of guilt, which can have um, perinatal symptoms of depression or anxiety as well. And then we also know that fertility interventions can be very stressful, and that can be a risk factor for paternal mental health conditions too. Circumstances surrounding pregnancy, we do know that unexpected or unintended pregnancies can also pose a higher risk for perinatal mental health conditions during pregnancy or after birth. Being a first-time father, being a significantly young father with limited supports, or older father, history of mental health conditions. Oftentimes, what we find is that someone who has had a history of a significant mental health condition after the birth of a child, there can be a sort of relapse or symptoms that come up. So that is something for providers and family members or caregivers to have conversations about before the birth of a child, on both sides too. Limited family or social involvement can also be a risk factor because there isn't that support to get breaks, to take care of self, to feel connected. Um, and then involvement in services. This can be a pretty broad risk factor, and includes quite a few different things. So if you have a family that has um, high stress, so that might be someone who is involved in child services. Maybe they're fearful that their child is going to be taken away. They maybe are involved in services, and their child was taken away. And then also legal circumstances. So if you have someone that is a single parent because of incarceration, those all are risk factors that we need to be aware of also. And then also, having a partner with perinatal mental health needs puts an individual at significant risk of perinatal mental health conditions for themselves too. And do you feel like this is a good time to take a little break
Yeah.
and answer any questions? Okay.
Yeah, I was just gonna say, could we take a pause for a minute? There's a couple things that
Yes.
might be worth exploring a little bit. So we have quite a few dads in the room. Wonderful. I love to see so many fathers coming to these conversations that are really focused on how do we educate providers around better working with you. So thank you for coming, and thanks for those of you that are sharing your experiences in chat. One of the comments that came up early on was about language, right? How we talk about mental health for infants, mental health for dads, etc. Any of the dads have an impression of what's a way that providers can talk about this that feels the most comfortable for dads? This is just a reach on my part, but um, are there words or language that would make it easier, or that makes it less stigmatizing or better to understand when we talk about mental health? Just curious.
That's a good question, Anne.
So this is Langston. I am in Kansas City. And so when I was so I do TNTA. But when I was more so on we'll say the front line staff, I think one of the biggest things to do is I'm not gonna say taking mental health out of it, but you have to more so generalize it and educate, and provide the education kind of going forward and then tie mental health into it. So with that being kind of saying is like, hey, mental health is important just as well as going to the doctor for like a physical or anything else and even utilizing the child as like an aspect, like, as you take your child for a well exam, mental health is just as important in that kind of capacity. And just really kind of going from what I'm learning now is providing more of a holistic approach to mental health. Um, so hopefully that kind of gave kind of a nutshell. So
Yeah. Thanks for joining us. Um, I haven't seen other folks from other states, but we always have some. And I also have to take a moment to thank our sponsor, our key sponsor for this series, which is the Department of Health. To your point, Langston, the folks who partner with us both at the state level and in the local health jurisdictions really understand how fathering and fatherhood inclusion is a public health issue. And so it really is about sort of how we form trusted relationships that build a bridge toward mental health that you're talking about, Langston. I love that. I've heard people use different language over time, and so I just thought I'd toss that out there and see. And so, Teresa, you were starting to talk about intergenerational transmission and ACEs. And so good lead in into this question that Gabe had about the most effective ways of helping dads with a history of high ACEs. How do we break those cycles of trauma? Of course, that's the whole topic, right? Is how do we break cycles? But any thoughts that come up as you think about that in relationship to a history of ACEs when the parent was a child?
And excuse me, I think that that's really important and can be a really impactful part of therapy. I like what Langston said. A lot of times, initially in sessions, talking in like regular people talk with clients about this is scary. When have you felt scared before? What, you know, using words that people use in everyday language, right?
Yeah.
And being able to see if there were things that happened as you're gathering a family history. I think that as providers, we need to be, and this is like medical and like mental health clinicians wise, being able to understand when we need to support that person in um, exploring and processing some of the different traumas maybe that happened in their past, because otherwise we're just going to be carrying that around and like pushing it down. And then when we have moments like this where there's a huge life transition, where there's a huge um, event in our life that causes significant chaos. I mean, it's a chaotic time for anyone. That a lot of times we don't have the capacity to push those things down. And so we're going to have things coming up that we didn't expect. I know, like, one of the funny things that people always say is like, I didn't expect to hear my mom come out of my mouth. Like, right as I was saying that, I heard something that I said I would never say to my kid. But it's kind of like that. It's like we lose some capacity to restrict that. And if, as providers, we're having these conversations where we can really be genuine in wanting to support these fathers, then that means that we need to support them in healing from the things that have happened in the past. And that's really the only way um, to end the generational traumas that keep happening, in my experience and in my opinion. So I could talk about that a lot. But I think just being able to offer support and being genuine, I think providers really need to understand that there can be healing, that we need to get into the deep end of the pool to be able to support them to being those healthy dads that they can be for their family.
Absolutely. And that's the whole two generation approach, right? Or in Indian country, seven generation approach around that kids are stressful, but we also heal through the love of a child. I cannot tell you how many dads have said to me, having this baby saved my life, and having this bond with this child has really helped me heal over and over again, because the love of a child is so powerful. However, when you put it on a happiness, scale across your lifetime, your parenting years are the least happy according to happiness studies. And I'm just thinking about that because the happiness world data just came out today, and the United States is slipping. We are slipping fast. So yeah,
And that's so sad.
say it again.
Oh, I said, that's so sad because this
Yeah.
is a time where there should be support to really embrace it. And there's such a great opportunity for us to support dads and being those um, educators for these babies and these kids, and supporting their families and having reciprocal support, to them.
Yeah.
It
So
should
Jason,
be that one of the best times. Yeah.
yeah. Yeah, it is a joyful time, and it is a stressful and chaotic time, as you said.
Oh,
And Jason is noting that sometimes going back to work is a relief, right? Because the work at
mhm.
home seems like it just never ends, and you never get closure, and you feel like you just keep, doing the same things over and over. And I'm thinking about Jose, who's in the audience, who does conscious fathering, and one of his peer conscious fathering teachers, Nick Kassovac, saying, you just have to tap into your inner MacGyver, and you just have to think it's poop, pee, sleep. It's these same five things over and over and over again. And after a while, it becomes kind of just a fog. And so sometimes, when you can't, when you need some break from that, work is helpful. So thank you for your candor
And
about that, Jason, because
yeah,
I sure felt that as a parent. I'm like, holy smokes, I feel like all I've done is nurse this child for a month straight, and I haven't done anything else.
well, and I think, and that brings up a really powerful piece too, that it will be on a slide, but we'll just skip it. That being able to have connections is so meaningful. And I think when we're at home with the baby, a lot of times we aren't communicating with adults. We're not having those meaningful connections. And so that's why, you know, work can be such a huge benefit, going back to work and having those relationship conversations, adult talk. But it also points out that we really need to be supporting people in having social connections while they're with their babies too.
Mhm.
But yeah.
So, Teresa, one of the other ones that maybe you're going to touch on later, tell me if you're going to talk about dad doulas at all. Is that on the
No,
slide later? Okay.
it
So I just want to put a
wasn't.
plug in
Yeah,
here
good.
around that. Oh, there's Jose. Jose, what was your thought?
Oh, hello. I was just putting in the chat so how important that isolation is, specifically for the male counterpart, where sometimes um, being open to talk about some of our emotions with some of my friends is a little, uh, once you get that icebreaker going, then you realize, oh man, you're going through a lot too. Wow. And so I think, and then social isolation caused by a lot of service or just elements too, right? I was at another conference and
Mhm.
they were saying how a lot of therapies they try to have provide service for outings for dads and their child, just opportunities.
Yeah, very cool. Nipuna, am I saying it correctly? Can you talk about your doula role with Parent Trust? That's super cool.
Hi, I'm a doula also. So I'm not a doula with Parent Trust. I run the family helpline at Parent Trust, but I do nights, and most of the time it's a dad who reaches out. And I really focus on, I'm there to help the parents, and I'm there to help them find their rhythm and work through the transition of the baby in their life, in their home, which is different from like a nanny or a newborn care specialist. I'm
Right.
not there for the baby. I mean, of course I'm helping with baby care because I'm helping the parents. And
Mhm.
that's like so a lot of times dads reach out because they need help
Yeah.
in their support role. So that's kind of interesting how it comes up, it comes like that.
Yeah, I'm super glad you said that because we're kind of tracking men doulas that are getting certified and trained now to be dad doulas specifically. And I love the fact that you're inclusive like that. And of course, Parent Trust, Linda McDaniels is a super fatherhood focused. Uh,
Yeah. I mean, our
yeah,
conscious fathering,
that's
it's
where it
just
all started, right?
a 3-hour class, but it has a plan, and it gives tools and helps dads feel prepared. So, and also brings the community because it's dads in a class taught by a dad, and they keep in touch after class. They've got their support system
Yeah.
started.
Well, and you've got one of the conscious fathering facilitators in the room
Mhm.
here today. Um,
Yeah.
but we have, as far as I know, and maybe I've missed some, we have now 4 dad doulas in the state, one up on the peninsula, one up in Skagit, and 2 in Spokane. And so really excited about the fact that at the state level, we're talking more about how important doulas are and doula certification and trying to get that build um, as a Medicaid billable service.
Yeah,
We
it is billable
Can
now.
well,
you
it
say
is
more
for
about what that
it
is?
is for moms, but it isn't for dads. And so, at least from what I
Ah, I
understand,
see. Well, it is for the birth, so it's tied to the baby.
right. But I was told by one of the dad doulas that he's trying to bill and he's getting turned down because they're saying it's only for mom, and that may be because um, there is um, the dad may not be a Medicaid client too. There's
Right.
probably nuances around it, but
Yeah.
the glass half full is that we have this happening in our state, which is really fantastic. So anyway,
And that's only for birth doulas.
for birth
Mhm.
doulas, yeah,
Yes.
yeah,
Medicaid doesn't cover postpartum.
yeah. So Teresa, can I just answer this one last quick question? Are you okay time
Yeah,
wise? Okay. So
yeah, no, that's fine.
yeah, so we have learned a lot from fathers who've had really difficult birthing experiences. And one of those is a gentleman who he and his wife, now ex-wife, but married at the time, were running a midwifery clinic. And he had a really difficult birth experience and afterwards felt very guilty and like he had let down his partner and the birth. And so he became a dad doula, and his role is to support fathers in their role around prenatal, perinatal support for that child, whether they're cohabitating or whether they're in an intact family, because a lot of dads don't know how to find their voice in that experience, don't feel like people are talking to them. And his experience was a very difficult long labor that ended up in a C-section. And he said the only time that the birthing team ever talked to him was when they turned to him and asked him for the permission for the surgery. And he felt so isolated from the process. And he said, dads need more support so that doesn't happen. And so it's a very unique role, but I do know that he's also had some challenges with hospitals letting him in and to support the dad, that they will say, yes, we can have a doula for mom, but not for dad. So we're still kind of figuring out the systems stuff around that. So I'm going to turn it back to you, Teresa, to let you keep going, and I'll keep tracking the chat, and I'll pop in if you take another break.
Perfect. So what we do know as far as barriers, and we did talk a little bit about this, so excuse me if I repeat something, but fathers are less likely to seek help or talk about the struggles due to stigma about parenting and fathers. societal expectations, and cultural norms. One of the other things too that we do know, and we briefly just mentioned it, but professional biases. So clinicians and providers oftentimes are looking for symptoms that would be present in moms. So not even talking to dads, right? So there's not even a resource or an option there to have the conversation. And a dad who is feeling vulnerable or uncomfortable in the emotion of sadness or anger or anxiety might not feel safe or comfortable bringing those things up. But then also the providers might be looking at depression in the wrong way. And I think we talked a little bit about using terms that fit more appropriately, that are more common words. And I think that that's probably one of those things that plays into provider bias and looking for the wrong symptoms for dads. Um, and also miseducation about paternal mental health. So that falls back into there, that understanding the differences between paternal and maternal mental health conditions and symptoms creates a barrier to care, because it's not even then offered if a provider doesn't understand it. And then also just expectations about gender roles. So providers might be looking at the example that was given earlier, the grandma and not the dad, to have the conversation about the baby at a well-child visit. So there's a lot of professional bias that can be creating barriers to services for these dads. We also do know that BIPOC fathers may experience unique race-based stressors during the perinatal period. And that kind of falls back in again to like bias, and that might be like systems biases, expecting something that isn't an actual fact.
Mhm.
Recognizing symptoms of paternal mental health conditions. So some of these, like I said, will overlap. We just need to look at how they're presenting when a dad experiences them. So loss, and I'm just going to go through these quickly. If people have questions, feel free to put it in the chat and we can touch on them again too. So loss of interest in activities that they once enjoyed, increased substance use or unhealthy coping mechanisms, difficulty bonding with the baby, withdrawing from a partner, family, or social supports, communication difficulties with partner, anger, violent outbursts, disconnect from the partner or other children. And I think that that's an important one too. So just a general act of pulling away from involvement in the immediate family system. And then being overly involved in work or tasks to involve or to avoid engagement. As you'll notice as we go through these, a lot of these symptoms are not describing emotional reactions, like internalized emotion. What you'll see is there is more externalized symptoms. So you're noticing more looking and turning to the outside. So like the increased substance use or anger or violent outbursts. You'll see more of those in these symptoms, and that is a direct relation to externalized depression symptoms, which we overlook a lot and oftentimes get misdiagnosed in this, particularly in the postpartum period. Next slide, please.
Sorry, I am typing my email for somebody. I can't walk and chew gum at the same time here. Okay. Sorry about that.
You're fine. So difficulty sleeping or changes in appetite, that is one that kind of goes both ways. It might look like more sleep. So for a mom maybe who is not sleeping as much, and that's kind of the thing that we look at when we're talking moms, we might notice that dads are feeling overly tired and not waking up for the baby, feeling like they need to disconnect and take a break often. That is not their norm. So so when we say difficulty sleeping or changes in appetite, yes, it's the same on paper, but it might look different in real life. Tearfulness, extreme sadness or overwhelm, feelings of dread, hopelessness, or failure, excessive worry, nervousness about health, safety, or coulds. And that oftentimes has a connection with maybe if there was a birth experience or a difficult pregnancy that had a lot of anxiety, we might notice that there's more of those kinds of things coming up. Worrying about hurting themselves or the baby. And that would be like scary thoughts. I know that we talk a lot about that with moms, but dads can get that too, as it relates to anxiety. And in severe cases, not as common as with moms, but with fathers, there have been noted cases of postpartum psychosis. And for the maternal population, that's about 1 in 1,000. So just so you know that is a very rare, but can occur. Okay. It's kind of different than what we sometimes are seeing in the news or hearing. So of note, and I mentioned the externalizing symptoms of depression. There's a term that has been used frequently, and they're doing more research and exploration on it, but about masculine depression, and especially as it impacts families in the parent or the postpartum time. Um, and masculine culture may prohibit someone from speaking up about depression because it's not accepted. Um, the definition of masculine depression is a subtype of depression characterized by externalizing symptoms like anger, aggression, substance use, rather than the typical internalizing symptoms like sadness and hopelessness, and is often linked to adherence to traditional masculine norms. So, if we think of fathers maybe having um, are going through a depression after a birth, it might look different because they are experiencing depression differently than their partner. There have been several studies related to this, and I have them at the very end. So when Anne sends it out, there will be you can research those resources. But there also is a gender-specific depression screening tool available, and that is something for people to kind of become more aware of. And I think that it needs to be explored more, and it is, but it just kind of feeds into the fact that we need to be doing more research to see how are we really identifying these dads.
So is the link to the tool at the end too, Teresa?
Um, I believe I put it in there as the 11th resource.
Okay, great. So there is a
Yeah.
comment about getting at the screening tool, and just
Mhm.
a thought um, around sort of the externalizing behaviors or acting it out rather than in. That is just really, really hard on relationships, right? That feels like the relationship is in jeopardy, and that there's it's me and what am I doing wrong, and so that's really hard to live with, and hard to recognize as depression because it may be coming out at a partner when it's really depression. So that is just like underscore underscore underscore, and I think we don't
Exactly.
talk about that enough.
No, and I think to piggyback onto that, I think that's where communication becomes so important, and supporting couples in being, if they are a couple or individuals, if they're single parenting, but being able to get communication skills and begin those conversations that they have a good technique or communication skills to start with. um, Definitely helps. It might not be the best, but like having some good ways of communicating before the baby gets here can definitely help, so that when one partner is feeling overwhelmed or not like themselves, that they can talk about it, or the other person can communicate it in a way that's going to be helpful and not exacerbating it. So, So another of note, so the rate of mother to father perinatal mental health conditions is 2 to 1 if we use the same screening tools for moms and dads. If we incorporate in the masculine or externalized depression, or use the EPDS that has a adjusted cutoff score for their screening, the number is closer, we're finding, to 1 to 1. So the number may be closer to equal than we think it is right now. And so more research is being done, but I just want to put it out there that the numbers might be looking closer to equality. Yes, the EPDS. There's a let me see here. Okay, perfect. This is our little break. So there is a cutoff score that has been identified for fathers. So using a different scoring tool than for the maternal screening, using that same screening, but with a different cutoff for dads. And were there any more? We can take a break for a second if you'd like.
So just kind of reflecting back, and you've kind of covered this, but I want to read his question out loud to honor that. And he's left the conversation, so he can't say it himself, but he says, is the reason you don't see the same kind of emotional reactions from men because they typically have less recognition of their emotional life?
I believe so. I think that there isn't, socially, we don't do a very good job. I mean, we're trying to, but we don't do a very good job of educating on emotions for men and boys. And so I think that being able, that's just an more of a natural response to not being able to express how they're feeling. And
Yeah, feelings, words, vocabulary
yeah,
seems to be slightly different between men and women.
yeah.
This
Well,
is a
and we
great,
know, like, primarily, right? We see differences between how a group of women might communicate and how a group of men might communicate, even when we go back to, like, hunter-gatherer kind of systems, right?
yeah. Well, Jose, I was thinking about your comment about how long it takes to kind of get to that level with a friend, a peer, and reflecting on, spending several days with long time friends of ours, and my husband and his buddy going out and playing golf all day and coming back. And I said, gosh, how's he doing? I didn't know he was having such struggles. And he said, well, what are you talking about? And I thought, oh my gosh, you just spent the whole day together. What the heck do you guys talk about other than whacking that little white ball around? So yeah.
Right. That's a good example, though, because it's like usually a physical outlet versus a conversational outlet, right?
Right,
So
right.
we need to be able to do a better job of, like, normalizing
Yes.
how we are having conversations for men.
Absolutely. And people were talking about language earlier, and I funded a program early in my career when I did a whole bunch of funding of children and family programs in Oregon. It was called Parenting Under the Hood, and it was a mental health program. And guys came together and worked on cars, and it was shoulder to shoulder. And it was so much easier for them to talk about things while they were focused on this task and doing this conversation in a way that wasn't threatening to them. And so the idea that Langston had earlier of sort of gently backing into it, but that also helped, as you say, normalized it. We're just going to have conversation and support one another because this is a hard time. So parenting under the hood, it
Right.
was great. They couldn't,
That's
but
awesome.
yeah, they had, I got a call from them one day saying, oh my gosh, we're having problems. And I said, oh my goodness, we're going to be on the front page of the paper. And he said, no, the problem is the dads don't want to go. And I think that's the other thing that we hear, though, from our fatherhood program participants is that having that social connection and that informal sort of mentoring and peer group is really, really needed. And then when the curriculum ends and the class ends, they're back out on their own again.
Mhm. Mhm. Yeah, and that's an interesting point too, because if you look at, um, why dads need to be healthy and engaged in their family, it's to teach their children how to have, like, they're going to be teaching their kiddos how to have conversations and how to be healthy too. So, yeah. So for supporting fathers, we like I said, we really need to normalize having conversations about perinatal mental health. Um, you know, having conversations that are open, and talking about it's okay that this is hard. It's okay to make mistakes. You don't have to do everything perfectly to be a good father or a good mother. And then educating individuals and parents on how to talk about it with each other. I think a lot of those opportunities might be during the perinatal or the pregnancy piece. We have people go to do hospital walkthroughs and do pregnancy, like birth workshops and things like that. But we need to be talking about how do we talk about when things are hard, and how do we know what to look for in our partners, or in ourselves if things are coming up. Encouraging professional and peer resources. So being able to, um, and this is a bigger systems problem, right? But talk about therapy and counseling as resources instead of something is wrong with you, you need to go to this. And especially for fathers, I think uh, that isn't going to work very well if it's like something's wrong with you, go do this. It doesn't feel good to anyone. Um, but having resources and sharing about peer resources, support groups, and help to develop healthy coping strategies. Um, and just understanding that there are alternative therapies. There's exercise, which for fathers, like we were talking about, and physical outlets can be really helpful. So like playing golf, maybe that is the outlet that's going to support peer connections and improve mental health. Massage, acupuncture, and just education about self-care and healthy lifestyle. So um, sleep hygiene, nutrition, exercise, and mindfulness practices. A lot of those things you can do at your home. Those things can be easily accessible, um, in your garage, in your front room, or different meditation exercises you can find on, like at most everybody has Spotify um, or Pandora or something. Like a lot of times you can find those kinds of things on those free resources. And also just reminding them that things are going to, it will get better. There is recovery. If we're feeling bad now, it's going to, there is recovery with support. So if something is feeling not right, that we can get help and we can feel better. Connecting with other dads, friends, and family members, social connections. That's why work can feel so good for some people to go back to work, being able to have that human connection, um, including fathers in perinatal care. This is probably one of the biggest pieces that has come up, being able to engage dads in healthcare services, and that being like, well, child visits. There's one pediatrician, I can't remember what state it is, but they I don't know how they require it, but they require fathers to come to one of the well child visits, and at that visit they do a screening for both partners and offer them resources. It would be amazing if we could do something like that, right? But we really need both parents to feel included and welcome. So I think it's an environment of welcoming those fathers to the appointment, and not like they're just a bystander, that they're just holding the car seat. and you know, supporting mom to get to an appointment. They're an active participant in this child's life. So advocating for pediatricians to have dads come in, and then using well-known and utilized perinatal screening. So having an understanding that there is the perinatal depression scale that has been validated for fathers, and that there is an adjusted cutoff score. And then also offering resources regardless of score, that's so important. So even if someone doesn't mention it, being able to have resources that are available, whether it's a phone number or a website, that it takes a little bit of the pressure off of the conversation, maybe in an office, to be able to let them think about it and come to it on their own time, versus making it, again, feel like something's wrong. You need this, you need to do this, or you need that. And how partners can help each other. So not only providers helping these individuals, but partners need to be able to understand how to communicate with each other in the postpartum period in high stress times. One of the first questions that I ask my clients is, how do you and your partner communicate when there's hard things? What have you had to go through that has been a struggle, and how did you get to the other side? A lot of times being able to have healthy communication patterns and healthy tools as it relates to communication can be really powerful as we move through the perinatal period. Having, like, learning how to ask questions, how to ask open-ended questions. There are some resources, and actually I'll send it over to you, and that you can send out if you want to. But just having simple conversations and using conversation starters can be a really great benefit for just that feeling of connection with the partner, and being able to have kind of like an easy start to a conversation that could be difficult or could point out some needs. Reinforcing positives and supporting in those things. Offering support and encouragement, so listening and reflecting back, letting their story be their story. And then if one person is involved in resources or support, let's say mom is involved in a support group or a mom group, and she notices that her partner is maybe struggling, being able to reach out to her resources to find out what's available too, that can be really helpful. And reminding them that they're not alone and that there is help. So in 2020, the APA, the AAP, the American Academy of Pediatrics, called on pediatricians to assess the mental health of all new parents, regardless of gender, and to make appropriate referrals when necessary. This is really important because here in Washington, there are resources for screening for providers. If individuals feel like they would like to be screened, that's an option, but providers should be screening at the well-child visits, and several insurances are reimbursing for both, for two caregivers at those well-child visits. So it helps to identify paternal mental health symptoms as well. One of the things that also was noted is that some pediatricians are screening for the parent that isn't there. So if, let's say, only a mother comes in, the doctors are finding that they can do the screening for the dad through the mom. And oftentimes that is enough to be able to point out a need for the partner and to give that those resources to take home. So we're finding that even if the father isn't there, that moms or other caregivers are able to do enough of the screening to point out if there's a need, which is amazing.
Is that Peds Northwest? Is that Marianne Woodruff's practice?
I wouldn't be surprised, but no, it was actually the research.
I'm going to ask her. That is fantastic.
Yeah, you should.
That is fantastic.
Yeah, I believe it's one of the resources at the end too. There was a study that's been done. So how should screenings be done? They should be done whenever they can. So any kind of office, if a client or a friend or an individual is presenting with any kind of struggles or symptoms of perinatal mental health concerns, a screening should be done by providers. The nice thing about the EPDS is that that's the Edinburgh Postnatal Depression Scale, is that it is a free resource. So anyone can do it. If you just Google it, it is a resource at the end of this presentation. But if you think that maybe you might be struggling, or you have a partner that might be struggling, or a friend, you can do that, and it will give you the score, and you can reach out for support. There are also other resources. I know Postpartum Support International has an app that you can download and take the screening, and it will give you a score and give you different resources. So that's it doesn't have to be just at a provider's office. It can be on one's own research or exploration. Okay. And also to point out that there, and I know I've said this like 10 times already, but just so that it's like really there, that there is a new cutoff score for fathers. So that's so important for us to recognize. There are a couple other screenings too. There's the PH29 and the GAD7, which offers screenings for depression and anxiety. But most commonly used is the postnatal depression scale. And again, even if someone doesn't score where they would need services or be a high cutoff or a high score, I just encourage everyone to have resources available. So research shows that support provided by partners is very important protective factor in reducing mental health disorders in both prenatal and post-period periods in a woman's life. So, all right, so we'll get to some numbers here, and then we can ask some questions. So I just thought, as I was doing some of this, the research for some of these slides, then I wanted to know what numbers we're really looking at. And these are really significant numbers. If we look at 72 million men identify as fathers nationally, and this is just, let's see here, it's a recent study, or recent number collection. And then 66 million of those 72 have been or are currently married. So, and we were talking earlier about how many families are married couples or single. And then as you look in more in the circle, we're looking at around 7 million dads in the United States are identified primary caregivers or stay-at-home dads, which I love this. I think this is great. But this just shows that, you know, we have this idea of maybe even stay at home, but this number is so big. We need to be recognizing that dads need to be included. I remember, I'm just going to tell a little short story. I was, I think we were in Legoland, and there was a dad with a baby in front of us, and the baby was probably like 10 months old, maybe a year. And it was like crawling around, and the dad was trying to juggle that baby, and like they had a toddler too. And he had a shirt on, and it said stay at home dad. It was like a coalition. And I just thought that was amazing. And that there was a group that was supporting that. And it was just so nice to see. And so, you know, I think we forget about some of these roles that fathers are taking, and that we need to really, really love them and give them support. And then 5.7 million, which is a pretty significant number as well, are single fathers. So almost 6 million dads. So just to have a key takeaway, why is it so important for fathers to be healthy in our children's lives? And children with involved fathers and healthy fathers have a lower risk of poor outcomes, including infant mortality, emotional and behavioral problems. They have better school performance, less alcohol and substance use, and less criminal activity.
Kids do better with dads in their lives.
Oh my gosh. So Anne, you know the elephant study that they did? Do
Yeah.
you know that study?
Yeah.
Okay, yeah, yeah. I just keep going back to that. We need dads, and we need them to be healthy. So some resources for fathers. If the dad isn't or father isn't ready to reach out for help, it's okay. Just have resources. If you're a provider, if you're a friend, if you're a family member, it's not going to hurt to have it scribbled down someplace, right? Even if they don't need it. Perinatal Support Washington has warm line resources. They also have a dad's group, and there's a resource guide for dads as well. There's also the Maternal Mental Health Leadership Alliance, and they have a lot of different resources for fathers, and it's amazing. They have different workshop or recorded webinars. They have handouts. They have flyers. I forwarded one of them over to Dieter. I'm not sure if that'll be in the packet to go out.
Everything you send us,
Dad's
we'll
Move.
send.
Oh, perfect. Okay, I have a couple more things, so I'll get those over to you. So they're really great resources. They update them a lot. They also are doing a lot of great work to advocate for dads. And then Dad's Move.
Yeah, and Dad's Move, of course, they are part of the council, and they work very specifically, came together around families with kids with special health care needs. And so they have a really strong mental health expertise.
And then Help for Dads, there's a Postpartum Support International page. There's also the International Father's Mental Health Day, which is the day after Father's Day, which features a social media campaign and talks about different aspects of paternal mental health. And then there's also the 24/7 maternal mental health hotline, but I want to encourage anyone who is a father or knows a father that this isn't just for maternal mental health. They have resources for fathers as well.
So can I just call out to those of you who are putting dad groups in the chat? Fantastic. Can you please make sure that they're on our father-friendly services map? And Dieter's going to pop a link in the chat. All you have to do is fill out a little quick survey, because we have many, right? We've called out one here, but we have many, and we're growing, which is exciting. So people are calling out resources in different communities. I'm thrilled to hear that. I didn't know about the Whatcom group, Gabe, so thanks for letting us know about that. And Jason's group in Whatcom, and then Department of Children, Youth, and Families has some resources that go into dad's groups. We also have, services across the state with Spokane Fatherhood Initiative and the Family Education Support Services, and DADS, which is Divine Alternatives for Dads. So we are doing better. We're doing better, y'all. But everybody in this room has a role that they can play around that in supporting and sponsoring a group. So I hope that is another takeaway. And
I would also like to
please do the evaluation. I just am going to let people know that, because they'll maybe do it while you do the last resources here. Dieter has put that in the chat, and he's also invited you to the next session. So go ahead and finish with your resources.
Okay, sorry, I'm cutting it close. Okay, and I would also encourage anyone who's putting in groups to contact Postpartum Support International and PS Washington to be able to get those resources out to those groups too. So PSI, even though they're national, they have they do put people back to the state that they are in. So having resources for them is great too, because they do get calls. So father supports and resources, and then for providers that are looking for education and training. PS Washington has different educational opportunities, but Postpartum Support International has mental health training, both in person and online, as it relates to father care too. And then there's a national warm line that is available. And the very last page is supports for anyone who wants further reading. And thank you so much. I could, like I told Anne, I could talk about this for a whole day. So I just really, really appreciate the opportunity to be able to be here. This has been a topic that's been near and dear to my heart ever since graduate school. This was my research proposal, and it was a lovely experience. And just knowing that we have to support fathers in their roles and having them be healthy is so important. So thank
Thank
you.
you so much, Teresa. You've gotten wonderful feedback in the chat. People are really appreciating the information. And I'm going to just say again, and Dieter, I haven't seen the link to the environmental scan go by, but for those of you who are saying, I've got a group, please, please, please fill that out, because what will happen is that when people are looking for father-friendly resources, they can go to that map and they'll see a little, icon on the map that they can research for themselves or for a parent. So please do that. We will save the chat as well, and we might try and reach back out to you, but it's harder for us to do that. The other thing that I want to also call out is that we're going to lead from this conversation into another difficult conversation next time with Ann Silvers, who I think was here today or may still be here today, who is going to be talking about intimate partner violence from women on men. And because we've done multiple different conversations about intimate partner violence, but this is the first time that we've really unpacked what that looks like, and what the prevalence is, what the trends are, what we know about it. And so we wanted these to be back to back so that people could really connect the dots around how we also need to focus on co-parenting and that couple's relationship in addition to the individuals. So please do join us for the next one. I want to welcome all the people who came for the first time. We had a lot of people who joined us for the first time, which says we're really on the right track. What happens when men are on the receiving end of partner abuse is the name of the next session, and Dieter's got that in the chat. So if you have services for fathers, please let us know. If you are asking questions about the summit, because it's about that time for people to start hearing from us about the annual Fatherhood Summit, I just want to let you know we will sadly not be doing a full summit this year because of the state budget situation. It just isn't possible for us to get those resources from all of our state agency partners and for them to travel. We have a travel freeze on, but we're not going to stop gathering and bringing folks together. So we are going to be holding an event in September, probably the third weekend in September. You'll be getting a save the date soon. And because you've attended this, you will be in the group of folks who get notices from us. But we will be doing that to come together around our Dad Allies Award. So we want to keep that awards going forward. So you will also be seeing soon a nomination form where you can nominate folks that are either allies to fathers or fathers themselves who have really contributed in our communities to help other fathers and support other fathers. So thank you, Teresa. You did an amazing job of really giving us the big picture and the details around this work. It is so important. And I appreciate the dads who sat through kind of a little bit of a clinical lecture kind of tone, which is not as frequent for us, but this topic really lent itself to helping our providers understand how they can best support fathers during that peripartum, prenatal all the way through the first 1,000 days period. So thank you, thank you, thank you. And please come back and see us next month. Dieter's put that link in the chat as well. And have a wonderful afternoon and go out and hug a dad. Thanks, everyone.